This is Case of the Week 19. My name is Dr. Johnson and I'm a gynaecologist from Southampton. The patient was 58 years old and postmenopausal. She'd had a hysterectomy in the past and had some symptoms of constant abdominal bloating, reduced appetite, feeling full quickly, and some minor pelvic discomfort. On transvaginal ultrasound of the pelvis, there was a left adnexal mass which measured 81 millimeters. This was a view of the other adnexa, and this was a view of the central pelvis. What's the diagnosis? Is it ovarian cancer, an ovarian fibroma, an ovarian dermoid, ovarian cystadenoma, or ovarian endometrioma? If we look at the images of the left adnexal mass, using IOTA definitions, the mass is solid because at least 80% of it's solid. Here is the mass, here is the outline, and you can see that all of this is solid. So at least 80% of the mass is solid, so that means it is a solid mass. Also, the mass is irregular because the internal contour here is irregular, and sometimes where you can see small internal cystic spaces, they can be irregular too. The mass showed strong vascularity, a score of 4 on colour Doppler, and 4 doesn't mean it has to be strong throughout. It can be strong in just one area, and I think it's strong here, but also strong and abnormal here. And you can see there's no shadowing behind the mass. This was the mass on the left side of the pelvis, and here you can see a normal ovary on the other side. The right ovary and the left mass moved separately on gentle pressure using the transvaginal probe. In a central view of the pelvis, here you can see the bladder. This is the top of the vagina, the vaginal vault. Remember, she's had a hysterectomy. Here are some small bowel loops, and this is ascites, and it's cloudy ascites. So describing the mass, you would say it's irregular and solid with strong vascularity, ascites, and no shadowing. This is an ovarian cancer. Using IOTA simple descriptors, this would have fit the malignant simple descriptor of a tumour with ascites and at least moderate colour Doppler flow in a postmenopausal woman. Using simple rules, it is irregular solid with ascites and very strong blood flow. The key features of ovarian cancer are that it often presents with few symptoms or with non-specific symptoms. You must do a transvaginal ultrasound of the pelvis. Then use IOTA definitions to describe the mass. Then use simple descriptors or simple rules where possible. Many malignant tumours have shadowing. In simple rules, this is a benign feature, but that does not make the mass benign. In the presence of malignant features, shadowing makes the mass uncertain. In this case, the mass did not have any shadowing. If the mass is uncertain on simple rules, you can calculate the risk of malignancy using an indicator like adnexa. For more information, watch this video on gynaecologyultrasound.co.uk. Thank you.